Thousands of people are getting tested for COVID before gathering for Thanksgiving. The Metro Area Regional Council has been keeping track of the numbers. Testing reached a new high on November the 11th when the 7-day average was just under 5,000 tests a day. Over the next 11 days, it fell to under 2,300. But in just one day, the average has popped back up to 4,300. Remember, though, that fewer tests means less confirmed cases. So the amount of people getting sick is probably much higher than what's being reported. Thank you for joining us here at 10. I'm Ellen McNamara.
And I'm Brad Stevens, anchoring from home. So can you trust the results of your test? You may still be putting your family and friends at risk. KCTV5 stands for you. Betsy Webster joins us now live to break down what you need to know before the big feast. Betsy?
Well, Brad, if you're planning to hit the road, you should know that even if you had a pre-trip COVID negative result, well, you could still be contagious on Thanksgiving Day. That's partly due to when you took the test and what kind of test you used.
Passenger traffic at KCI is about half what it usually is for Thanksgiving travelers, but it's the highest it's been since the start of the pandemic. KU and KSU both offered free optional testing before students left campus on Friday. But a test taken last week doesn't necessarily mean you're in the clear this week, in part because the virus takes a while to incubate.
It's a very tough line to draw.
That's why the University of Kansas Health System's Director of Infection Prevention and Control advised earlier that pre-visit isolation was the best option.
We, even at the health system here, have seen employees who become positive at 12 days. So even if they took the test, say at 6 or 7 days after their exposure, they would have been negative.
I started showing some very minor symptoms.
One person who knows about false negatives from personal experience is Dee Dee Stevens, the wife of our own Brad Stevens. She went to a drive-through testing site, and the test came back negative. But then she lost her sense of taste and smell, so she went to her doctor for a follow-up test.
When I went back after 4 days, it came through as positive.
There are two main reasons for false negatives. There's the 14-day incubation period, and there's the type of test. The nasopharyngeal PCR is the gold standard. The antigen test, often called a rapid test, has more room for error. KU in Lawrence is offering a saliva version of the PCR. Dr. Hawkinson knows that not everyone is going to stick to their household bubble. But if you expand it, know this, he says. The biggest risks are large groups, but someone you know is no less risky than someone you don't.
We assume that because we know them or because we're seeing them, that they're safe, but unfortunately we don't know everybody that they're seeing.
And here's an example. He says a friend of his had parents or has parents who had some neighbors over to their house. Well, they found out later that those neighbors had previously had their grandson over to the house. Then they found out the grandson tested positive. The grandparents tested positive, and then that man's parents also did. That's the chain how things work. But Brad, the good news I'm hearing right now with Dee Dee, she tells me that she is feeling much better and she's going to be out of her 14-day isolation period tomorrow, just in time for Thanksgiving. Is that right?
Yeah, that's right. Just in time. Yes, we have a lot to be thankful for. She feels a lot better. Still doesn't have a sense of taste and smell, but she's good, so we're all good and can't wait to get out of quarantine. Betsy, thank you.